Hi, my name is Robert Liebel. For my communicable disease project, I am doing chlamydia. Some facts about chlamydia. Chlamydia is a common sexually transmitted disease caused by infection with Chlamydia trachomatis. Chlamydia is transmitted through sexual contact with the penis, vagina, mouth, or anus of an infected partner. Ejaculation does not have to occur for chlamydia to be transmitted or acquired. Chlamydia can be spread prenatally from an untreated mother to her baby during childbirth, resulting in conjunctivitis or pneumonia in some exposed infants. Signs and symptoms of chlamydia. Chlamydia is known as the silent infection because most infected people are asymptomatic, which means they do not show any signs or symptoms. Symptoms of chlamydia include pain in the eyes, lower abdomen, pelvis, testicles, or vagina. Also, pain during intercourse or urination, abnormal vaginal discharge, discharge from the penis, or vaginal bleeding. Repeat infection with chlamydia is very common. Getting chlamydia multiple times increases a woman's risk of serious reproductive health complications. Chlamydia is treatable. For treatment, chlamydia can be cured with antibiotics. People with chlamydia should not engage in sexual activity for 7 days after a single-dose antibiotic regimen has been started, or until completion of a 7-day course of antibiotics, to prevent spreading the infection to partners. Antibiotics will cure the infection, but they will not repair any permanent damage done by the disease. If a person's symptoms continue for more than a few days after receiving treatment, he or she should return to a healthcare provider to be re-evaluated. Repeat infections with chlamydia are very common. Getting chlamydia multiple times increases a woman's risk of serious reproductive health complications. What if you do nothing? Left untreated, chlamydia can cause cervicitis, which is inflammation of the cervix in women, and urethritis and proctitis, which are inflammation of the urethra and the prostate in both men and women. Chlamydial infections in women can lead to serious consequences, including pelvic inflammatory disease, tubal factor infertility, and ectopic pregnancy, which is when the baby is fertilized when the egg is fertilized in the fallopian tube. The history of chlamydia. Chlamydia was discovered in 1907 by Stanislaus von Provazac in Germany. That is a picture of him to the right. The genus part of the name chlamydia comes from the Greek word chlamys, which means cloak, and the species part of the name, trachomatis, is also Greek and means rough or harsh. Epidemiology by person. Any sexually active person can be infected with chlamydia. It is very common among young people. It is estimated that 1 in 20 sexually active young women aged 14 to 24 years has chlamydia. Chlamydia is the #1 notifiable disease that is reported to the CDC. In 2017, there were 1,127,651 cases of chlamydia reported among females. For males, there were 577,644 cases of chlamydia reported in 2017. Chlamydia rates are highest among Blacks, American Indian men, and Native Hawaiian/Pacific Islander women. Here is a graph that shows the rates of reported cases of chlamydia by sex in the United States between 2000 and 2017. As you can see, the rates are steadily going up with a few dips here and there where they go down, but for the most part it is on the rise. And the top line in the gray is the women's rate, and the bottom line in the black is the men's. As you can see, women have a higher rate of chlamydia. Epidemiology by place. In 2017, a total of 1,708,569 chlamydia infections were reported to the CDC in all 50 states. Rates of reported cases of chlamydia were highest in the South, with 560.4 cases per 100,000 population, followed by the West, 524.3 cases per 100,000 population, the Midwest, 514.4 cases per 100,000 population, and the Northeast, with 483.3 cases per 100,000 population. Between 2016 and 2017, the rates in the United States increased 6.9%, from 494.7 to 528.8 cases per 100,000 population. Between 2013 and 2017, rates increased in all regions, with the largest increase occurring in the West, 421.1 to 524.3 cases per 100,000 population. That is a 24.5% increase. Here is a map of the United States showing the rates of chlamydia. As you see, the dark blue indicates a higher rate of chlamydia, reported cases of chlamydia, and you see a higher concentration of the dark blue in the southern part of the map. Epidemiology by time. Chlamydia continues to be the most commonly reported nationally notifiable disease, with 1,708,569 cases reported in 2017. Rates of reported cases over each of the last 4 years have increased. Rates increased 6.9% between 2016 and 2017. The rate of reported cases of chlamydia in women was nearly 2 times that rate in men. However, between 2013 and 2017, the rate in men increased 39.3%, whereas the rate in women increased only 11.1%. Chlamydia and substance abuse. Chlamydia is not directly transmitted due to drug or alcohol use. However, the physical outcomes of drug and alcohol use are where the relation comes from. Chlamydia is transmitted from having unprotected sex. When people have been drinking alcohol or using illicit drugs, they are more likely to make unhealthful decisions in regard to sex. When individuals have been using drugs or alcohol, they may not think as clearly as they would if they had been sober. This can cause people to have unprotected sex when they otherwise would not have. When people are under the influence, they have a false sense of confidence and may have sex with a complete stranger. It is also possible that one or both of the participants may not be aware they have chlamydia, and they may not know they are passing it on. Some prevention measures for chlamydia. A primary prevention measure for chlamydia is abstinence. This prevents any exposure at all to the disease and eliminates the risk factor. A secondary prevention measure is using condoms. Secondary prevention aims to reduce the impact of a disease that has already occurred. Tertiary prevention methods would be taking antibiotic drugs. Tertiary prevention aims to soften the impact of an ongoing disease that has lasting effects. Here are my references from the CDC and articles on the CDC website about chlamydia and statistics. And that is the presentation. Thank you very much.